Good afternoon, everyone. Well, I'm saying good afternoon, it's evening now. Good evening and welcome to our Thursday online session. So we're going to go ahead and get started. I just want to say as a reminder, we do not have class on Tuesday, February 21st. We do not have class. It is an observation of Mardi Gras. So I hope everyone have a safe and happy Mardi Gras. You will have a 5-minute video in your daily assignment on tomorrow. On Monday is your chapter 25 exam. Chapter 25 exam is on Monday, the pathology and laboratory. It is, I think it's only 20 to 25 questions, but we will do a review. So remember to read your emails, check in your e-learning, the regular daily announcements. Make sure that you're reading your emails in its entirety. Make sure that you're posting your daily assignment in the upload. If you're unable to upload, please post in comments. Please do not email me your assignments if you're able to post in comments or upload. It just takes a longer time for me to put a grade in to post those assignments back into your assignment. So we're going to go ahead and get started because we need to do a review. And again, we're closed on Tuesday in observation of Mardi Gras. So right now, I'm going to share my screen. So we're in chapter 25, pathology and laboratory. This is in your textbook. And in your daily assignment, you'll notice that I post, and when you look in your assignments, you'll have your objectives there in the assignment. Hi, Dallas. I would like to welcome you all. This is Dallas. This is one of our new students.
Hey, y'all.
Hi, welcome, welcome. I'm glad you can join. So we already went over, I had in your daily assignments, the objectives that's going to be covered. This class, this chapter here is 6 days long. So the objectives that's going to be covered explain the format of the pathology and laboratory section, understand the information in the pathology and laboratory guidelines, demonstrate an understanding of pathology and laboratory terminology, differentiate amongst the organ or disease-oriented panel codes. So we're just going to go through those first 4. And in your review, we'll go over some of the questions that will be on your exam. So in here, I guess you all can see in your daily assignments, I kept going over and reviewing the format of the pathology and laboratory section. The pathology and laboratory section of the CPT manual is formatted according to the type of test performed. It's the type of test performed, not anything else. It's only formatted according to the type of test performed. Automated multi-channel, panels, assays, and so forth. So we're going to move on. And it says the services in the pathology and laboratory section include the laboratory test only. The collection of the specimen is reported separately. So that's important to know. In the pathology and laboratory, only the laboratory test is considered functional. The collection, when you're collecting a specimen, it's reported separately from the analysis of the test. So this is an example. If a technician in a clinic laboratory withdraws blood by means of venipuncture from the arm, and the blood sample was then analyzed in the laboratory, you would report 36415 for the venipuncture as shown in this figure, figure 25-1. In addition to a code to report the test performed on the blood in the laboratory. So those are, it's an addition to, it's not going to be that one code. Most pathology and laboratory subsections contains notes. Always read the notes in the pathology subsections. They're always going to have notes, and read those notes, because if you're not reading those notes, your code would be inaccurate. Whenever notes are available, be sure to read them before assigning codes from the subsection, because specific information pertinent to the code is contained in these notes. Organ or disease-oriented panels. The codes in the organ or disease-oriented panel subsection 80047, 80081. So if you're looking for an organ or disease-oriented panel and you get to 80083 or 84, you're in the wrong area. The codes in the organ or disease-oriented panel subsection is in 80047, 80081. Make sure that you're always paying attention to the code range. This is what's going to really help you. You have to pay attention to the code range. The code range is always going to be there. So if you go outside of that range, then you know that that's an inaccurate code. They're grouped according to the usual laboratory work ordered by a physician. It has to be ordered by a physician for the diagnosis of or screening for various diseases or conditions. Groups of tests may be performed together using automated equipment depending on the situation or disease. For example, during the first obstetric visit, a mother is commonly asked to have baseline laboratory tests performed to ensure that appropriate antepartum care is provided. CPT code 80055 describes an obstetric panel that would typically be performed during the first obstetric visit. So this code is mostly only going to be performed during that first visit. To assign a panel code, each test listed in the panel description must be performed. Additional tests are reported separately. The development of panels saves the facility from having to report each test separately, and is often more economical for the patient. You cannot assign modifier 52. This is on your test. You cannot assign modifier 52 reduced service with a panel. Make sure you're highlighting this. This is on the test. This probably is a true false. I might have on there, you can assign modifier 52 with a panel, but it says here, you cannot assign modifier 52, which is a reduced service, with a panel. So if you're doing a blood panel, which is multiple services, you cannot apply a modifier. For example, if all of the tests in the obstetric panel were done except the syphilis test, you could not report 80055 obstetrical panel with modifier 52. You would instead list each of the tests separately. And here is that coding shot. Make sure that you all are paying attention and reading your coding shots in the chapters. The coding shots are very, very important. And it states here, be careful when coding multiple panels on the same day for the same patient. Sometimes several panels include some of the same tests. For example, a hepatitis B surface antigen test is included in both the obstetric panel and the acute hepatitis panel. It would be inappropriate to report the same test twice. You have to be very careful with that because that can be documented as fraud. So you have to pay attention to the tests that you are taking and make sure that it's not included in that panel. So when they're giving that panel of different tests, when you're reading the documentation in that patient's chart, make sure that you're checking to make sure that that test isn't already listed in the panel, because then you cannot, it's inappropriate to report that same test twice and can be designated as fraud. The laboratory and pathology reports in the panel, the patient's medical record, will describe the method by which the test was performed. There are many different methods of performing the same test. For example, a urinalysis can be automated or non-automated and can include or exclude microscopy. It is necessary to know these details. If you are to assign the correct urinalysis code, if the details you need are not in the medical record, ask the laboratory staff or physician for further clarification. So what do you think they're saying if they're saying to exclude or include? What do you think the different tests that they would be doing with that urinalysis that you would need to check to ask that physician? reading in that, what would you think would be the difference? It says a urinalysis can be automated or non-automated and can include or exclude microscopy. It is necessary to know these details if you are to sign the correct urinalysis code. If the details you need are not in the medical record, ask the laboratory staff or physician for further clarification. So what are different types of urinalysis that can be done that would make that code different?
Pregnancy.
Right, but what would be the different steps that they do before they would get to that pregnancy test? What are two different forms that they can use for that urinalysis? When you go to the doctor or whatever and they do a urinalysis, they either can do two different forms.
They could do one where it shows everything, or they can do one that shows exactly what you're coming in for.
So that's true. So the difference is one can use a dipstick, you know, when they just put it in there and test the urine on that stick. And then the other would be, they would read it under a microscope for other tests. So you know how sometimes you go in and you just give them a cup and they read it right off the little stick, that urinalysis. And then if they feel that something else is going on, or it might be a yeast infection or some other type of infection, they take it and then they put it under the slide. So those are the different types of tests. So those codes would be different. If it was done by just a reading, like with a dipstick, that would be coded one way. And then if you had to use a microscopic view, that code would be different. And then the difference would be, remember, one is the laboratory test only, and then the other one would be by microscope. So the codes would be different. So here we go in here. Organ or disease-oriented panels. Number one, hepatic function panel code in a patient with hepatitis B serum virus, chronic. We're not going to do that ICD-10 code. I just want to know, what is the CPT code? What is the code? And you know, I would need the page that it's found on. What is that CPT code for exercise 25-1? And remember, the hint when we're doing this, it's under organ or disease-oriented panels, and it's in the pathology and laboratory section. And then if you go up, this is to help, the organ of disease-oriented panels is in code range 80047 through 80081. So whatever that answer is going to be, it's going to be within that code range. If you go to 80082 or 83, you know that's not the correct answer. And here is the question right here again. Hepatic function panel code in a patient with hepatitis B serum virus, chronic. What is the CPT code? And I need the page number that you would find it on. Dallas, do you have your panel, your manual yet? Would you say, Samara?
No, ma'am, I don't.
Okay, so remember I gave you those codes in your e-learning, whereas you can put in and you can find a code like that as well. And also, Dallas, like I said, at the code range, when you're looking, remember to stay within this range. If you go outside of this range, then you know you're in the wrong section.
So will it be 80076?
That is correct, Samara. Very good. What page are you on?
599.
Okay, page 599. Page 599 is where you can find the answer, and the code is 80076. Number 2, how many laboratory tests must be included in a hepatic function panel? How many laboratory tests must be included in a hepatic function panel?
7.
Yes, 7 is the correct answer. So next we're going to move on. Drug assay. Laboratory presumptive drug class screening. So for drug assay, this is the code range, 80305 to 80307. It's not that wide range at all. From 80305 to 80307. It's performed to identify the presence or absence of a drug. The drug assay is performed to identify the presence or absence of a drug. Testing that determines the presence or absence of a drug is qualitative. This drug is either present or not present in the specimen. And that range is very short, 80305 to 80307. The screening of drug classes is divided by method. 80305, optical observation, which means what? What does optical observation mean?
Optical means eye.
Right, so it's observed from the eye, from your vision. Instrument assisted, what does that mean?
The instruments that are assisting with it.
That you use to test it. And then instrument chemical analyzers, what is that?
The instruments you use to analyze the chemicals in what you're looking at.
So they'll add chemicals to it to actually see what is used in that, like what drug is being used. So on here, next, quick check 25.1. What is the repeat clinical laboratory test modifier? What is the repeat clinical laboratory test modifier? Remember, when you need to find out what a modifier is, it's located where in your CPT manual?
Front of your book.
In the front of your book. In the front of your CPT manual are all of your modifiers. So you would look on repeat clinical laboratory test. What modifier is that?
91.
You said modifier 91? Not modifier 91. The repeat clinical laboratory test modifier.
That's diagnostic.
Thank you.
This is a modifier. We use this modifier often. What is the repeat clinical laboratory test modifier?
Oh, no.
No. Wait.
Sorry.
Repeat, look at the repeat clinical laboratory test modifier.
$59.
Yes, 59. So what does modifier 59 state?
Distinct procedural service.
Right. A procedural service, modifier 59. Samara, I see you making those faces. I see it.
Can you explain that again?
Yeah, so in the front of your textbook, that's Dallas. Dallas, you asked that?
Yeah.
Okay, so you don't have your
I see
manual.
under modifiers in the step book.
Yes. So look at modifier 59.
Okay.
And what does modifier 59 state?
Distinct procedural service.
Right. So it's a distinct procedure service, which is a repeat clinical laboratory, which is a distinct procedure that's being reported, that's being done. And it's a repeat clinical. So that means that that is something that's done often
Okay.
when you go into the laboratory. You'll get more into it once you get your book. You'll have a better understanding, Dallas.
Yeah, I'm just trying to
Right. And remember that your modifiers, you always look at that modifier to try to determine if it's needed to be used or not. And like I said, you're getting in when we're doing coding, you missed the basics, but in your wraparound with the Ferris wheel, you're gonna go back to all of that. You're gonna get the basics. You're coming in like, you know, which is a good week, but you're coming in where they have had all of the basic coding and everything. And so a lot of you gonna have to wrap back around to it in your Ferris wheel cycle.
Okay.
But still, we're still able to do one-on-one to like catch you up, and we can do some reviews if you would need that.
Okay.
So next, toolbox 25-1. Jason has been sent to the clinic to have a drug test, as are all employees of the company for which he works. The company requests all employees be screened for barbiturates and tricyclic antidepressants. Question. Your clinic used a presumptive multiple drug classes chromograph method to test the two drug classes. How would you report the service chromatographic determination of these two drugs? Look at it again and read it. How would you report the service chromatographic determination of these two drugs? Remember where you're gonna look. You're gonna look for in the code range, drug assay. Remember, organ or disease-oriented panel, but we're in drug assay now. So you're gonna look, it says laboratory presumptive drug class screening. So it's gonna be between 80305 and 80307. It's performed to identify the presence or absence of a drug. Testing that determines the presence or absence of a drug is qualitative. The drug is either present or not present in the specimen. So you know you're only looking from 80305 to 80307. And the question asks, Jason has been sent to the clinic to have a drug test, as are all employees of the company for which he works. The company requests all employees be screened for barbiturates and tricyclic antidepressants. Your clinic used a presumptive multiple drug classes chromatograph method to test the two drug classes. How would you report the service chromatographic determination of these two drugs?
Wouldn't it be 80307?
Correct. And what does 80, what page are you on?
604.
Page 604, and what does that code state?
By instrument chemistry analysis, analyzer, immunoassay, chromography, either with or without chromography, includes sample validation when performed.
Exactly. It's stating the exact same thing that it states in this statement. Presumptive multiple, see multiple, that's more than one drug class. Multiple drug classes, chromatograph method to test the two drugs. So the next one, if your clinic did not use chromatography, but rather did a single drug class method by instrument test systems for each of the two tests, how would you report the test? Number 2. And if the first one was 80307, what would the second one be? Read what the one before that would be.
80306.
Right, and what does that say?
Read by instrument assisted direct optical observation, includes sample validation when performed.
Correct. So the easy way to make sure that you're in the right area, know the code range. So that was a short little range for the drug essay, and that's for so anything in the drug essay section would only be in 80305 or 80307. So for any type of drug testing that you're doing, you know that it's going to be in that little small range, 305 to 307. Next, therapeutic drug essays. So it's a difference. Therapeutic drug essays is 80143. Look, it's a wider range through 80299. So look at the difference. The therapeutic drug essay is a test for a specific drug and for the amount of that drug. Therapeutic is for a specific drug. Not so the difference is, so in the drug essay, let's go back, laboratory presumptive drug class screening. It's a screening to identify, this is just to identify the presence or absence of a drug. So then when you go to the therapeutic drug essays, 80143 through 80299, it's a test for a specific drug and for the amount, how much of that drug that's in the system of that drug. Many types of drugs are listed in this subsection. If the drug is not listed, it is possible that the quantitative analysis may be listed under the methodology. Example, immunoassay, radioassay. Therapeutic drug assays are performed to help the physician monitor the level of medication in the patient's system or to monitor the patient's compliance. For example, levels may be measured to make certain the patient is getting the correct level of antibiotics. Blood specimens for drug monitoring are usually taken during the drug's highest therapeutic concentration, peak level, and at the drug's lowest therapeutic concentration, throw or residual level. Peak and throw levels should be within the therapeutic range directed by the physician. The drugs are listed by their generic names, not their brand names. Doesn't that sound like a test question? Yes. The drugs are listed by their generic names, not their brand names. A physician's desk reference that lists pharmaceuticals by the generic and brand name will be helpful as you code drug testing and assays. One location of drug testing codes in the index of the CPT manual is under the main term drug, subtermed by the reason for the test analysis or confirmation. Therapeutic drug assay subsection codes can be found under the main term drug assay and subterms of the material examined. For example, amikacin digoxin. So next, So make sure you get the distinguish between the regular and then here is the therapeutic. Therapeutic drug testing and drug assays. Drug screen of cocaine, presumptive, read by instrument assisted. What is the CPT code for that? And remember, we're in the therapeutic drug testing and drug assays. So that code range is 80143 through 80299. Drug screen of cocaine, presumptive, read by instrument assisted. So it wasn't by optical, it was by instrument assisted. What is the CPT code? So let me give y'all a little hint. So remember, this is drug testing and drug assays. So what did it say? It says one location drug testing codes in the index of the CPT manual is under the main term drug, subterm by the reason for test, analysis, or confirmation. Therapeutic drug assays subsection, that's what we're under, right? Therapeutic drug assays. Subsection codes can be found under the main term drug assay and subterms of the materials examined. For example, amikacin and digoxin. So remember the term drug assay, that's what we're looking for. Therapeutic drug assays. Where is it? It's going to be found in the main term is going to be drug assay. And you definitely need to be very familiar with this because you all are going to be coding this. And you're going to be reading this in the patient's chart to be able to get that provider paid. So that main term is drug assay.
Eight 0306
Yes, what page are you on?
604.
And what does it say on page 604?
Read by instrument assisted direct optical observation.
Correct,
Includes sample validation.
right. So make sure you're writing these page numbers down so you can go back and reference to look at what she found and what it states. 80306 is the correct answer. What page again? I'm sorry, Amber.
604.
Page 604. Do you see it, Samara? You're on mute.
I see it.
Were you having complications with that one? What were you looking under?
The drug assay, but I was looking for the name of the thing, but I didn't see cocaine.
Uh-huh.
How
Yeah,
funny.
But I did it first.
I
uh-huh.
was for cocaine.
Right, but see,
Me too. That's what I did first.
right, so you see the difference on how the difference is with the prior one prior to it, and then this one here is drug assay, and that's why they say that main term, drug assay. So you have to just pay attention to those codes, and you see it was outside of this range because it was a drug assay. That's why I went back down here, main term. So number 2, identify the amount. This is different. Identify the amount of total digoxin in the blood, quantitative. What is the CPT code? So if you go back up and you look at the therapeutic drug assay, it says therapeutic drug assays 80143, 80299. Test for a specific drug and for the amount of that drug. Many types of drugs are listed in this subsection. If the drug is not listed, it is possible that quantitative analysis may be listed under the methodology. So on here, what is it asking for? The quantitative, right? And it says identify the amount. So what is that telling you? It says right here, test for a specific drug and for the amount of that drug. So it's going to be in that code range of 80143 through 80299. See, the terminology is different. This here wants the quantitative, which is the amount. The other one was read by instrument, presumptive.
There's power inside all of us to live our passion. And Vixen works on the inside to help heal your skin from the a key source of inflammation inside the body that can cause eczema. So adults can have long lasting, clear skin and fast.
So what is that code? What is that code for that one?
Reactions can occur that can be severe. Tell your doctor problems such as eye pain or vision changes, including blurred vision.
You're looking for the quantitative, the amount of total digoxin in the blood.
So would it be 80162?
That's right. And what does it say, Samara? What page is it on?
It's on 608. Demoxin total.
Exactly, which says total means what? The amount.
And
So that is correct. So we're going to move on. Because I want you all to get a feel for each section because they're different. And once you get those code ranges, you're paying attention to the code range, you'll have a better understanding. So this is evocative suppression testing. So evocative suppression is 80400 to 80439. Testing is performed to measure the effect of evocative or suppressive agents on chemicals constituents. For example, 80400 is reported when a patient undergoes testing to determine whether adrenocorticotropic hormone, ACTH, is being produced in the body. The patient may have adrenal gland insufficiency. Note that following each of the code descriptions is a statement of the services that must have been provided for the code to be reported. So this is where you pay attention. Note that following each of the code descriptions, and it is a statement of the service that must have been provided. So this service has been provided already for the code to be reported. For example, the requirement to report 80400 ACTH stimulation panel is cortisol, 82533 times 2, or 2 cortisol tests were performed. Code 80400 bundles 2 units of 82533 into one code. Before you can assign 8400, however, you must read the code description for 82533 to ensure that the code reports the correct test. So this is a little difficult in here because you have to read everything in that patient's chart first to make sure you get the correct test. It says caution, Remember, read your coding shots, read all of your caution in your chapters. Remember that the codes from the pathology and laboratory section are only for the test performed and do not reflect the complete service provided to the patient. To code the components of evocative suppression testing, consider the following. If the physician supplied the agent, report the supply using 99070 from the medicine section. See, this is a little tricky part. Or a HCPCS code. If a physician administered the agent, report the infusion or injection with codes 96365 through 96379 from the medicine section. If the test involved prolonged attendance by the physician, report the service with the appropriate EM code. So see, this is a little tricky here. Pathology clinical consultations. So we're going to go through this little part. Each specimen may be reported separately, but each slide from that specimen may not. And it says here, a specimen is a sample of tissue from a suspect area. A block is a frozen piece of specimen, and a section is a slice of a frozen block. A pathologist prepares a specimen by cutting it into blocks and taking sections from the blocks. The preparation of a frozen section is illustrated in figure 25.2. The number of sections taken depends on the judgment of the pathologist as to the number of areas of the specimen that need to be examined. The frozen section is placed mounted on a slide or held by other means that allow the pathologist to view the tissue under a microscope. Again, remember that coding shot. Each specimen may be reported separately, but each slide from the specimen may not. Sounds like a true false. When one block is sectioned and examined, the service of examining that first section is reported using 88331. The second and subsequent sections of the same block are included in the reporting of 88331. If another block from another area, a second block was sectioned, the first section would be reported using 88331, and subsequent sections from the second block using 88332. Look at this part. You cannot use 88332 without first reporting 88331. Code 88332 is marked as an add-on code, one that is used only with another code. Its function is to report subsequent sections that were examined. Here are your rules for CMS rules. The edits bundle 88329, pathology consultation during surgery, with 88331, first tissue block, and 88332. That's for each additional tissue block. By issuing this guideline, CMS includes the frozen sections in the consultation bundle, which would usually be reported separately. So we're going to stop right here. I'm going to go this one apart, then we're going to go and do the review for the exam. So this is what I was telling you about the dipstick. When it's done by optical, they just use a little stick. Here's the urinalysis. They place it in a little tube and they read it. Urinalysis, molecular pathology, and chemistry. Many types of tests are located under urinalysis, molecular pathology, and chemistry subsections. 81002, this is a long range, to 84999. Urinalysis codes are for non-specific tests performed on urine. Chemistry codes are for specific tests performed on material from any source. Example, urine, blood, breath, feces, sputum. For example, a urinalysis using a dipstick, this is what I was telling you all earlier. 81000 through 81003 would report the presence and quantity of the following constituents: bilirubin, glucose, hemoglobin, ketones, leukocytes, nitrate, pH, protein, specific gravity, and urobilinogen. Any number of these constituents may be analyzed and reported using a code from the urinalysis subsection 81000 through 81099. However, if the physician ordered an analysis of the urine specifically to determine the presence of urobilinogen, reduced bilirubin, and the exact number of urobilinogen present qualitative analysis, you would choose a code 84580 from the chemistry subsection. The main things to remember when coding from these two sections are: identify specific test, determine if the test was automated by machine or non-automated manual, number of tests performed, identify combination codes for similar types of tests, whether the results are qualitative or quantitative, and method of testing. So we're going to go on now and review for the exam. Like I said, this exam is not going to be that long. I think it's 20. Because I know you all are closed that next day, so you still have all week to take that exam. So we're going to go ahead and review. Okay, number one. How many levels of surgical pathology are there? How many levels of surgical pathology are there? This is for your exam on Monday. Remember, this is being recorded, so you don't have to rush and try to write it down. It's being recorded so you can go back and review. How many levels of surgical pathology are there? This is also found in your PowerPoint slides. So please review your PowerPoint slides. How many levels of surgical pathology are there? Let me pull up these PowerPoint slides.
Is it 19?
I'm sorry. How many did you say?
I said 19.
You said 19 tomorrow? No, you didn't. How many?
You gonna take a bath, Silver? You can't take a bath.
I'm just pulling up some of the slides. How many levels?
No, Silver.
6.
Yes,
6, right?
Dallas, that's correct, 6.
We gonna do it?
There are 6 levels of surgical pathology. Levels, 6 levels. Next, what type of drug test measures the amount of a drug in the specimen? We just went over this. Is it A, quantitative, B, qualitative, C, confirmatory, or D, immunoassay?
Quantitative.
Which one?
You said it shows how many?
What type of drug test measures the what type of drug test measures the amount of a drug in the specimen?
Quantitative.
That's correct, quantitative. All right, Dallas, good job. Next one. What type of drug test measures the presence of a drug in the specimen? What type of drug test measures the presence of a drug in the specimen? Quantitative, qualitative, confirmatory, of immunoassay? Which one? What type of drug test measures the presence of a drug in the specimen? Quantitative, qualitative, confirmatory, of immunoassay? We went over that one as well. Look in your chapter 25 about the drug assays and the drug testing is right there. I'm waiting. I don't hear nobody saying nothing.
You said
What type of drug test measures the presence of a drug in the specimen? Let me go back to it.
qualitative, I think.
Which one you saying, Dallas?
Qualitative.
That's correct. Qualitative. Correct. Next. In the pathology laboratory section of the CPT, drugs are listed by their blank names. I shouldn't have to read this, huh? What is it?
Brand name, the generic name.
Yes, Samara, but I say, I know you joking. Look at
Generic name.
I know. Yes. In the pathology laboratory section of the CPT, drugs are listed by their generic names. That is correct. Next. In what section would you find codes used to report venipunctures and arterial punctures? A, surgery, B, EM codes, C, medicine, or D, pathology laboratory? In what section would you find codes used to report venipunctures and arterial punctures? A, surgery, B, EM codes, C, medicine, or D, pathology laboratory?
Ready?
And I just want to go back a slide while you're looking for that. In your PowerPoint slides, make sure you view them. They show it right here. Therapeutic drug assays, reports presence and amount. It has quantitative, then it goes down. So just make sure that you're reviewing those PowerPoint slides, because majority of your questions and answers are in your PowerPoint slides. The question is, in what section would you find codes used to report venipunctures and arterial punctures? A, surgery, B, EM codes, C, medicine, or D, pathology? A, surgery, B, EM, C, medicine, D, pathology, or laboratory? So I'll give y'all that one. It's surgery right here on this PowerPoint slide. Surgery, surgical pathology. Next one. Codes in the pathology laboratory section. Evocation, suppression testing include which of the following? A, complete service. B, test, injection, substance administered physician time. C, injection and substance administered, or D, test only? Codes in the pathology laboratory section. Evocation suppression testing include which of the following? A, complete service. B, test, injection, substance administered, physician time. C, injection and substance administered, or D, test only? Excuse me. So we're going to have to read through these PowerPoint slides. Huh? Look at the answer right here on a slide. Evocation suppression testing. So
Where's the?
I'm sorry, I didn't hear you.
I was trying to see where the PowerPoint was.
The PowerPoint is in your e-learning in the grade section, and it's labeled PowerPoint slides. That grade section. You want me to go back so I can show you?
Yeah.
Okay, so see right here in your grade section. Over here, the grade section with everything is labeled. And then right under NCCT packet with answers, it says PowerPoint slides. Do you see it, Samara? Do you see the PowerPoint slides?
Oh yeah, I print them out.
Okay, but I'm saying you were able to see it.
Yes, ma'am.
Okay. Dallas, do you see it?
No, probably because I was looking at it
On your phone?
on my computer. Yeah.
No, on your computer, you should be able to see it. It's in your grade e-learning section. It says PowerPoint slides. It's right under your NCCT packet with answers. Because I'm in your module and this is where it is right here.
I mean, wow.
So we have a few more minutes. Let me go over to the next one right quick. And Dallas, I'll come back with you with it.
Okay.
What is the name of the subsection with pathology laboratory that deals with the laboratory work done to determine cellular changes? What is the name of the subsection within pathology laboratory that deals with the laboratory work done to determine cellular changes? A, microbiology. B, surgical pathology. C, genetics. Or D, cytopathology. I'm gonna read it again. What is the name of the subsection within pathology laboratory that deals with the laboratory work done to determine cellular changes? So look at your PowerPoint slide. Cytopathology. Identify cellular changes. Common laboratory procedures, examples of pap smear, codes divided on type of procedure, technique used. So everything that we have covered, everything that's going to be on your exam, as you can see, is in your PowerPoint slides. So make sure that you're reading your PowerPoint slides. I'm going to do a 5-minute review again on Monday. I also did a little review tomorrow that you will receive, but I also do a little similar review on Monday. But remember, everything that we have gone on over is in your PowerPoint slides.
Oh, okay, I got it.
You found it, Dallas?
Yeah, I got it.
Okay. So the last question I asked was, what is the name of the subsection with pathology laboratory that deals with the laboratory work done to determine cellular changes? Look at this PowerPoint slide. Cytopathology 88104 through 88199. Identify cellular changes. Common laboratory procedures. Examples, pap smear. Codes divided on. Types of procedure. Technique used. Cytogenetic studies. Branch of genetics concerned with cellular abnormalities and pathologic conditions. Example, chromosomes. So really, to pass this test, only thing you would have to do is review your PowerPoint slides. I mean, it's open book. So it's open book. So it's no reason for students to be making B's and F's. Because if you're watching these videos, if you're reviewing your daily lessons and looking at those little short mini videos and reading your PowerPoint slides, all of the answers are provided. So when you're making D's and F's, that's showing that you're not reading your PowerPoint slides, you're not paying attention to your question, your review sessions. That means you're just getting your answers out the back of the book, which is not going to help you when it comes time to your certification exam. You can get all the answers you want out the back of the book, But when it comes time for that certification exam, you're not going to have the textbook to get the answers from. You're going to have to know how to find those codes. So remember, you have to read. Medical billing and coding is nothing but reading, 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 reading. If you do not want to read, or if you do not like reading, you will not succeed in this field. And this is an ever-growing field. If you look at any of the classified ads online, it is a popular career to be in, and the salaries are good. So please read your information, read those coding shots, read the caution shots. All of that information is very important, and it will help you when it comes time to take that certification exam. Every Tuesday, we have NCCT practice exams. I have all of your packets in e-learning in that great section, everything that you would need to study for that certification exam. Everything that we're covering is on that certification exam. You have all of the packets in your great e-learning. Read them, print them out if you can, you know, forward it to another email if you want, or whatever, to make sure you have it. If you can get those and study those questions and answers, you're guaranteed to pass that certification exam, but you have to read and review the information. So that is all I have for you all. Remember, we are closed on Tuesday in observation of Mardi Gras. Your exam for chapter 25 is on Monday. You have until Sunday to complete the exam, and class resume on Wednesday. No school on Tuesday. So you all have a safe and happy Mardi Gras, a safe and peaceful weekend. Enjoy your weekend, and I will see you all on the video tomorrow. If not, I'll see you all on Monday on the video, and I'll see you next week. But you all, please be careful, stay safe, and enjoy your weekend. Bye-bye.
Thank you.
Bye-bye.